to the 3-day EKG challenge. So it is night 2, and we are so happy that you have chosen to come back with us and do arrhythmias tonight. And in true form, we also have Michelle here, Coach Michelle, and she will also be rounding out our session tonight with another game, because you guys said last night, we want more Michelle. And so, as promised, you'll get some more Michelle at the end of the night. And here she is. Hi, Michelle.
Hey, everybody. Super excited to be back tonight. And Skelly is with us, and I've got a new game. So awesome.
You know what? You can tell Michelle's a new game because the fire in her eyes. She's like, let's go. Let's go. All right. Excellent. So we should be live and streaming. There also should be a link if you still need the workbook. We are going to do the workbook tonight, a few pages. So if you want to have that printed out and ready, that would be super helpful. We have TK. TK, I saw you asking about the live events, and hopefully you saw them on the screen, but also they are on our website at theconqueringcardiology.com. And we're doing Chicago next up, and then I think Pensacola. San Antonio is definitely one we want to think about attending, because Michelle will be there, as well as I think Coach Megan's flying in for that, potentially Coach Ashbury as well. So we have lots and lots, and so Coach Samantha as well. So it's going to be a big party in San Antonio. And Coach Sean, I forgot about Coach Sean. So it's going to be fun. We'd love to see you guys on the road. This I mentioned yesterday is going to be my last year going on the road, since I have a new dog. So he takes a lot of my attention. But anyway, welcome back. And we're going to go ahead and share my slides so we can do some basic arrhythmias. Now, and we covered last night a couple things. We talked about the fact that the waves, right, they matter, and who's producing the waves. We also talked about a little bit of what you guys are up to, and what, where you're calling in from, kind of what your positions are, and, some of your unique challenges. And that was fun to start getting to know you guys. But we also gave away some prizes last night. They are in the mail, and there's a couple of little extra bonus things that I put in the little gifts for you guys that you won. And I'll be showing you the gifts that we're going to give away tonight, which are just going to be so exciting. And then also we'll be giving away a scholarship tomorrow night. So you definitely want to keep your eye out for that. Yahoo for gifts. Yes, Jenny, yours went out this morning, actually. Yeah. So can't wait to see what you think. So excited. And let's kick off now that we're right on time, and we will do some basic arrhythmias. So, all right. Who's ready to learn about the arrhythmias? I want to hear some yes, let's do it. Me, I want to hear who's ready, so we can kick this off right. Let's put some fire in the chat. Let's get fired up to do some arrhythmias. Yeah, all right, good. Leanne, by the way, Daniel, I love that. So Leanne, by the way, I don't know if you guys saw that Leanne posted some helpful things. Hint, hint. She posted a time zone converter, and that, Leanne, was very helpful. So thank you for that. You are doing exactly so far. So follow Leanne, be helpful and encouraging, because we're going to give away a scholarship, right? We talked about that last night. And yeah, worldwide, I know it's super important. So we're going to be giving away a scholarship, and we're looking for you, right? We're looking to see who's encouraging and positive and lifting up their fellow students in this challenge, because that's what we really, really, really like to see. So cool. Now that you're ready to get started, what we're going to do is we're going to do we're going to show you the arrhythmias tonight. Then Michelle's going to do a little practice in the game. And then we have a bonus session where we're going to get more practice on Thursday evening. So just so you know the flow of this. Yeah, we got this, right? TK, I love it. Yeah. See, this is what fires me up. Got your workbook here. Exactly. Asbury, I love it. Okay, so here's your workbook. This is, again, you can download it from the link that Tori's putting everywhere, our concierge Tori, and you can just download it, right? Print it out. I've seen people put it on their iPad and fill in the answers. But these are the answers for you guys if you wanted to look over them. And yeah, super, super helpful. So again, we talked about this yesterday, right? The left and right depolarization is the atrial contraction. That's the P wave, right? The sinus makes P. We talked about the Q wave being initially the first negative deflection. So it goes down. That's the Q wave right here. And you could get some practice labeling. We did that last night. And we talked about, right, that the Q should be less than a third the height of the R. Now, the next one down, just so you can completely read my chicken scratch, the 3 waves of the QRS represent the ventricles depolarizing. And so if there is a downward deflection, right, after the P, that's a Q. If it goes straight up, it's an R. So Q means negative, R means positive as a general rule. And then the R wave is the first positive deflection, and the T wave should be round, that was key, and upright in all leads except for AVR and V1. So that's the answers to the workbook here. And then as far as the next page, we talked a little bit about what a U wave looks like yesterday, where to find it, that it shouldn't be there. And one of the causes is hypokalemia. We also talked about how the intervals could be clues for us. For example, a short PR, which is the second line down, can mean Wolff-Parkinson's white. So lots of clues live in the intervals. We also covered that, right, it's measured from the beginning of the P to the beginning of the R, and it should be 120 to 200 milliseconds if it's normal. The other thing is when we're measuring, right, we talked about the P to the R, that's easy. And the most important segment that we talked about was the ST. That is where we look for elevation and depression, okay? Oh, you love the handouts, that's pretty, I'm so glad. And then depression can be caused by hypokalemia, ischemia, and some medications like digitalis, okay? So we're always looking for elevation and depression. And then we talked why the QT is important, because we can prescribe medications that prolong the QT and lead to things called torsades de pointes. And then lastly, we're looking at if a rhythm is regular or irregular, we're using the R to R interval. And that's what we're going to use today in our solving our rhythms. Okay, so Tori asked, what's your favorite thing so far? And I would love to hear the answer to that as well. And while you're typing that in the chat, what your favorite thing has been, we're going to talk about this case. Okay, so this is a patient with palpitations for 3 days. You can see he's grabbing his chest. His wife is very worried. This is not any real patient's faces. This is just a random image, but it sure makes it seem a little more real, because you know this happens all the time. The person is being stubborn. Their mate says, no, you're going to the provider, right? So they come in, and of course, they don't go to the ER. They're going to come see you, and you know, if you work in primary care, that this is definitely going to happen. Oh, good. The final cardiac is July 12th. Cool. Jenny says the games. Michelle, you're right on track. So palpitations for 3 days. So when you have a patient who looks to be probably 60s or 70s, your differentials are going to be a lot different than somebody who's young. You're going to be thinking about the bigger, badder wolves, so to speak. So things like BTAC, things like atrial fib with rapid ventricular response, things like that. And he says he feels like he's going to pass out. So that's very concerning, and kind of makes me a little more concerned about the bad things like VTAC. Now, of course, he has a history of hypertension, hyperlipidemia, and diabetes. That's like the trifecta of everybody who comes to see us in cardiology. They always have this, but you always ask about, previous vascular disease, like, does he have history of AAA? Has he had any stents previously? Is he on any new medications? What's his blood pressure? All these things. What are you doing when you feel like you're going to pass out? So these are all things that are relevant to ask. So thinking about getting an EKG, that's always a good place to start. Now, this was actually a real EKG, which is fun because this is the epitome. This case is the epitome of why we're doing this. So I wanted just to kind of put this out here and show you an EKG that's not pretty, not perfect. It's a real EKG. And so our question here becomes, well, I don't know if, this is a good enough EKG. We talked about you have to have a good clean EKG. Is this really a clean EKG? Is he shaking? He's not really shaking, but he's a little slow. So there's 3 questions, and we're going to talk about these questions that you want to ask yourself about rhythms. So question number 1, is it fast or slow? Fast or slow? You want to type in the chat which one this is. Teresa. Teresa, our monitor tech's in the house. Okay. Fast versus slow. Next question is regular versus irregular. Okay. So type in the chat what this is. Is this slow or fast? Is it regular or irregular? And then you're going to ask yourself, is the QRS narrow or wide? Okay, it looks to be a little bit wide. Okay, we were looking for something under 3 small boxes. We would look at the intervals just to make sure. But essentially, our big question is this regular or irregular? And do we think it's a clean enough EKG? So we have Leanne saying she thinks that this is slow AFib. TK saying this is wide and irregular and wide. Good. So you all are on to this. Do you think this is just artifact is my question. Do you think this is just artifact? So that's the first thing. Okay, good. It's not just artifact, but it sure looks like it could be. So the next thing you can do, exactly, Leanne pointed out, it's still irregularly irregular. So if you come on over here and you look to see if on your rhythm strip, which is the bottom of this, we're going to talk about 12 leads tomorrow. We're just focusing on this. The bottom of this is the rhythm strip, and it is irregular and it is slow. So good job. Okay. So irregularly irregular. And the next question you have to ask yourself, is there a P wave? Now, what you have is a wandering bag of worms baseline. There's no discrete P waves. So now what we have is a slow, irregularly irregular with no P waves rhythm. And do you think that this could explain why he feels like he's going to pass out? Okay. Yes. And no P waves in any leads, including the clearer ones. Exactly. Yeah, this could absolutely be a reason for him to not feel like he's going to maintain perfusion, right? So yeah, his brain would be not happy because he's not getting enough perfusion. So good. You guys are getting it. It's AFib. This is AFib. And bonus question, for anybody who's taken my class, you know this, but bonus question, in the intervals, if we had them up here, what would we see for the PR interval? What would we see? The PR interval, would there be a PR interval? Would there be a PR? No, there isn't. But what will the machine put? You guys are all right, there isn't one. But what will the machine put in place of that? What can we use as, yes, and Matt said it on Facebook and Teresa on Zoom, an asterisk, exactly. So when you see an asterisk, that's also a clue that potentially it is atrial fib. So this patient, the first question we would ask is, are you on any new medications, right? Are you, and you look for in their list for definitely 2 types of medications. So tell me in the chat, what medications would you be looking at their list? Like right off the bat, you see this, and you know he has a history of hypertension. Tell me 2 medications you're looking at his list for. 2 medications. Okay, yeah, Leanne, beta blocker and calcium channel blocker, Teresa metoprolol. Lisinopril could make his blood pressure low, but it wouldn't affect his heart rate. But yeah, also digoxin could as well. So these are all good answers, you guys. Excellent. Coumadin, it wouldn't really affect his heart rate, but man, I'd want to know if he was on Coumadin if he fell. Eliquis, these are good because that's my next question. Neighborhood association. I don't know what your name is on Facebook, but I know you're a neighborhood association. So that's the next question is, does this patient meet criteria, right? And so we would use a certain score for that. But I don't want to deep dive too much in the woods, but you're absolutely right, because our next goal would be prevent stroke. Take them off. Yes, have you been told you an AFib before? These are good. But then you want to take them off of anything that's potentially making them slow. So calcium channel blocker, DIG, metoprolol, those are all excellent. Okay, so the secret to reading EKGs is really patterns. Okay, and the patterns that we're looking for almost seem like faces once you get to know them. And it's the heart conduction here that is trying to communicate with us in its own little Morse code. So the sinus node is firing, hopefully, sending the impulse down to the AV, down to the ventricles, right? But sometimes things go awry, like you just saw. Okay. All right. Now, the questions are here for you. Again, narrow versus wide. Narrow is going to lend yourself more to a SVT or a VTAC. And we were thinking about VTAC for that older gentleman. SVT is more of a young person's disease. And why do I say that? Because if you have SVT and you're having issues, we're going to get a hold of you and do an electrophysiology study. The next question, is it too fast or too slow? Do we need to intervene right now? is it regular versus irregular? Could it be a sinus node issue, or is it sinus rhythm, or potentially AFib? This one here, this is just a sample. This is a picture I pulled up, but you could see that there's a beautiful discrete P here, a narrow skinny QRS, and a beautiful round asymmetric T. And here you can see that you've got a nice R to R interval that is regular. So that's what we're looking for. All right, now we're going to go through some atrial arrhythmias. And there's a long list of things that can come from the atrium. Okay, so flutter, atrial flutter. You can have AFib or AFib with RVR, supraventricular tachycardia. You can have sinus tach, which is very common. We see this a lot every day. Wolff-Parkinson's-White, which is not so common. And of course, premature atrial contractions. These things all come from the top. Now, type in the chat, what do you think the rhythm at the bottom is here? What do you think? We've got our questions, right? Slow versus fast, wide versus narrow, regular versus irregular. What is this rhythm? This is bread and butter. Yes, El Popa. This is AFib. Absolutely, because there is no discrete P and it is regularly irregular. Good, TK, no P, absolutely. Okay, so we've already done one rhythm. Let's keep going. So this is the most beautiful rhythm, the one we always hope to see, otherwise known as normal sinus. And the way we know it is normal sinus because we've got a rate between 60 and 100, check. It is regular, check, check, check. And we also have a beautiful P wave that looks to be the same shape or morphology, okay? And the PR interval is normal. We want it to be under 200 milliseconds, which it is. And the QRS width honestly looks a little wide in this computer generated drawing, but we'll just say it's narrow under 120. And this is a normal sinus. The PQRST, exactly. Now, this one is one that we'll see infrequently, but a lot of people will think that this is atrial fibrillation because they'll come through and type in the chat if you know what this is. And so they'll come through and they'll be irregular, and maybe you're auscultating or feeling their pulse and it's irregular. And you're like, oh, well, we better get an EKG and see what that is. Well, the question is, and you're thinking about hyperkalemia, I think. Yeah, potentially, right? What clues would you have that would tell you about hyper K? Is it a Brady? We'd have to march it out. But I see Leanne and I see TK, or Teresa, sorry, saying that this is a sinus arrhythmia. Now, this is indeed a sinus arrhythmia. That is not AFib, although you might think it is because it's irregular. It's trying to trick you. So, because you look at this and you're like, yep, that looks normal, normal, normal. And then you're like, oh, there's like a little bit of a pause here. So some people would say this is a sinus pause, but what you really need to decide if it's a sinus pause versus a sinus arrhythmia is just taking a longer strip, okay? If you see this pattern repeating, it's a sinus arrhythmia. If you don't, it's a sinus pause. But essentially, you're looking at the P waves and making sure that they are present. And breathing is the usual cause for this. It is not something dangerous. You just have to make sure you're not calling it something that it isn't. So this is sinus arrhythmia. The next one we have is sinus bradycardia. And you know this one because it is slow and regular and still narrow complex, slow and regular, and it's under a heart rate of 60. Okay, so there's a couple things we can do to cause this. Yeah, looks to be about 40. Okay, there's a couple things we can do to cause this, and it's kind of the same thing that we saw earlier. Medications, calcium channel blocker, beta blocker, digoxin, some antiarrhythmics. So we want to make sure that we stop any drugs that the patient is on. So the patient that we saw earlier, the one with the palpitations and the near syncope, he was on a beta blocker of some sort. I forget, it was bistolic, I think. And so we had to take him off the bistolic and consider emergency room for him, but he didn't want to go. We had to tell him not to drive, and we had him stay very close to the hospital. But the beta blocker washed out in about 3 days out of his system, and he went up to a heart rate of 90. We were considering putting a pacemaker in, right? You always have to consider that, but is it a reversible thing? Okay, is it reversible? And so that's the question you always ask about these bradycardias. Yay. Yes, meds, exactly. Good thinking, you guys. All right. So now we're plugging along through the rhythms. Okay. So yeah, and might need a permanent pacemaker for the meds. We give them in some cases. Yeah, sometimes if they need to be on those meds and we can't avoid it, then permanent pacemaker might be considered. Exactly. So let's do another practice strip here. We got to ask ourselves the questions. Here we go. Is this regular? Do you have P's? And are they the same shape? Is the QRS skinny? And it is. So this is none other than a sinus, right? This is a sinus rhythm. Yes and yes, right? And when you calculate this out, it's going to be either a little bit Brady. They're not pretty. Yeah, you're right. This is going to be a sinus Brady, most likely if you count it out. You could do the rule of 300. But the patient, this is a normal sinus. The P waves are not pretty. I will agree with you, Leanne. And they're not pretty because they appear to be notched. And we do want smooth P waves. That was a very good pickup on your part. What is this rhythm? Let's see if we can call this rhythm. This is the opposite of sinus Brady. We do have P's. Yes. Good job, you guys. Good job. I'm seeing some sinus tach. Seeing some sinus tach answers. This is all right. We know that because it's fast, it's regular, and it's narrow complex. So let's talk about some potential causes for sinus tach. Let's talk about some causes that we might see. So KJ says atrial flutter, but this is a little too slow for flutter. And in order to say flutter, we would need a 12 lead, right? And it would probably be a little bit faster, but it could be. It's always good to consider. So yes, sinus tach, things that can cause sinus tach, anxiety, good. Give me some more. What can you be drinking right now that could cause it? Thyroid disease, I love it. Medications, absolutely. Husband, hyperthyroid, stress, exercise, drugs, alcohol, these are all really good, you guys. Caffeine, perfect. These are all good. So the treatment for this is really figuring out the reason. Fever and pain is a good one too. And then infection as well. That was a good one. Stress. Yes, all these are great, you guys. So you guys nailed all the causes. Another one just to consider would be potential COVID, heart failure, anemia. Those are all things. So good job, you guys, on Facebook and Zoom. Exercise, also a good one. You guys are thinking of all the things. I love it. Okay, so this one, oh, dehydration. Good one, Susan. Here's a pretty rhythm, also coming from the atrium. And this is our monitor tech is nailing it over here on Zoom. You guys, if you're on Zoom, you're probably watching her. She's like out of the gate. Now, what's your secret, Teresa? What made you say that this is atrial flutter? I think, Leanne, I think you must work in cardiology, Leanne. You are, I think you're definitely on the cardiology somewhere. So Teresa, what made you say flutter? I see lots of people are saying flutter and I'm loving it. But tell us 5 years experience. Okay, but what is your, okay, Leanne, you're an RN. I knew it, cardiac RN. What is your eye seeing? Share with us, Teresa. What is your eye seeing? Because you're going there fast. She says no P wave and no T. Okay, so you're right. These are not P's. What are these waves called? These waves are called something. They have a special name. Does anybody know the name? Sawtooth, yes. Johnson Valley Village. Flutter, exactly. Marissa, hey. So yeah, this is flutter. These are flutter waves, sawtooth. They're also called F waves, okay? So all those different words are appropriate. And you will see an asterisk in the PR interval. Yes, Eileen and Marissa, you guys are on it on FB. Okay, now this one is easy. We've already seen this tonight. Picket fence, shark teeth. I love that, Teresa. Those are good. I've used the picket fence. I like the shark teeth. I always get nervous though about saying shark anything because of the shark fin ST elevation that we sometimes see. And if you say shark, people are like, right. So I always stick to the fence, picket fence. So, all right, looking at this is AFib. You guys know that, but tell me what an AFib patient may complain of. Like what might get them on your radar? What could an AFib patient come in complaining of? There's so many things, right? Yes, good job, Marissa and Johnson. Baby Shark. I don't know how that goes. That Baby Shark song. I think once you get it in your head, yeah. Yes. Tired, shortness of breath, palpitations, exercise intolerance. These are all perfect. Good. Dizziness. Good. Yes. Feeling out of steam. These are really great. Feeling like my heart is slipping a beat. SOB, shortness of breath. Yes, these are all perfect. Good job, you guys. All right, so there's one little rhythm we're going to talk about in the junction. Now that's the junctional rhythm. Faint, short of breath, confusion. These are all good. So junctional rhythms are going to lose the P. And that's how we know the junction's in charge, because we don't have a P wave. We have a narrow skinny QRS, and it's still regular, but it's slow. Because sinus makes P, there's no P, the sinus is not in charge. So this is the AV junction. AV junction. Yes, I agree with you, Michelle. She should join us in our 30-day challenge. Okay, good. Now, let's talk about a little bit of ventricular things, and then we're going to hopefully get to Michelle's game pretty soon so we can practice. Now, when we talk about ventricular things, none of them are good. This one is a hard one for people because you will not have a P, and yes, this is called idioventricular. You won't have a P, and you'll also have a wide QRS. The regularity is there. It's certainly regular. It's slow, and the QRS has a wide, bizarre appearance. Okay, so slow, wide, regular. It's coming from somewhere, idio, in the ventricles. This is not a good rhythm. Sometimes people don't have a pulse with this. And then finally, an agonal rhythm. This is when you're definitely not going to have a pulse. This is very unorganized. It's bizarre. And this is somebody basically who is just dying, active dying heart. And you hope that you never see this, but it's a rate of 0 to 20 beats per minute. And you hope that you never see this, especially if you're in clinic where you don't have the resources. That would be bad. So a couple other ones we need to know. Type it when you know it. This one's a, yes, start CPR, KJ. This one's a sight rhythm, meaning you see it, you know it, you say it. You got to know these like off the top of your head. You got to be as fast as Teresa with these, right? So TK also in the house with VT, love it. KJ also saying VT. So yes, this is ventricular tachycardia. Tell me why. Tell me why. Somebody put in the chat why. Give me more. Good job, Matt and Johnson. VT, one of the pretty ones that will kill you. That's so elegant, Leanne. I love that. But give me why. Why is this VTAC? Monomorphic, yes. Wide, complex, rate over than 150. No P. If Teresa said this actually very appropriately, she said wide, complex tachycardia, get a 12 lead, right? Because you want to definitely distinguish. Okay. All right. So let's go to the next one. What's this one? What is this one? VFib. Excellent. And to be precise, course VFib. Exactly. Because it's nice and just chunky and juicy. It's not flat and fine, right? So this is ventricular fibrillation. This patient absolutely needs, check the leads, check the patient, right? We talked about last night that people can have toothbrush tachycardia or, basically they're fine or a lead is off, although the newer machines usually account for that. So more electrical activity to shock back to something regular. So yes, let's defibrillate them to reset everything and hope that the sinus node takes over. Okay, and this is basically anarchy. So we're going to do the last next page in our workbook, and we're going to have Michelle take over in a minute. So let's make sure that you have your workbook, and let's label these together so that you have them written down. Okay. Number one, what is this rhythm here? Number one. This rhythm is, yeah, I know. Thank you, Tori, for helping everybody get the workbook. So this rhythm is, does anybody want to type in the chat? Oh, yes. Nice. Okay. Everyone agree? This is AFib. There is a irregular baseline. There is an asterisk in the PR interval. It is a irregularly irregular rhythm. So good. This is AFib. Next one. What one is this one? You've seen this tonight. Maybe some of you for the first time. And El Popa, you are really coming out of the gate here. Good. We're almost done, Michelle. We're going to have you take over in a minute. So yes, this is sinus arrhythmia. You guys all got it. We know that because it's got normal PR intervals, but it's slightly irregular. Okay, this one, we've seen this one, number 3. This one's easy. Yeah, everyone just type that in real fast. Idioventricular. Good job, you guys. Good job. Kim Murray, is that a block 2? No. So Kim Murray, if you're ever thinking it might be, you would basically have a dropped QRS, which you don't have. And when you have a PR, it's consistent. So if you're thinking like, is it a sinus pause? Maybe you just get a longer strip and you see if this cycle is repeating itself. All right, excellent. So the last one is idioventricular. Yes, Matt, and yes, everybody on Zoom, you guys got it right. And last but not least, let's label this last one. This one is slow, no P, and regular, and therefore it is ajunctional. You guys got it. You guys are all on top of it. So here's my chicken scratch for you. And I think we are ready to show you the prize and then transfer over to Michelle. So the prize tonight, remember this one, Michelle? This was so fun. Remember? Oh, so cute. I'm going to stop my share. If you want to get yours up. The prize tonight is going to be some cat window badges. We're going to give some of these away. So excited. And I don't know if you guys have noticed, there's paint on my nails. That means good things for you, because I have been outside today painting more paintings. So some of you will win a little mini painting as well, and an RCAT badge. Like, what could be a better combination here, right? So Michelle, take it away, and we're going to tell you, I got to tell you the hashtag to put in. So you can put hashtag RCAT. That's the RCAT badge. And you can type that in if you want to be selected to win. And we'll be getting you these fun things in the mail. So Michelle, are you able to share screen?
Yes, I am.
Oh, good. Okay.
Yep. And okay, we have another game, guys. Hopefully you had fun with the game last night, because I did it again tonight, but I did a different one. So it's the same treasure one. So I did the same treasure chest game. I just made some new EKGs so we could do rhythms again. Oh no, Baby Yoda, he is worried about this. I don't know, Baby Yoda, should you be worried about this? What do you think? Oh, y'all are just, I can't believe how fast you type. I'm like, there's no way I can type that fast. And there, I'm looking for the chat because it disappeared on me. Okay, so Baby Yoda says, I'm worried because Baby Yoda's baby. He's not really knowing too much about the EKGs yet, so he wasn't sure. And you are right. This was just a sinus rhythm. Don't worry, Baby Yoda, not a problem. Those R's match up. There's always a P with the R. The T waves look okay. Everything is good, no problem. So let's think, what about this? What do you think about this? Are you concerned about this at all? What do you think? Anything in particular? Popo, do you think that was a little bit of sinus Brady? I think it might have been like right around 60. So not a bad one on that one. I'll give Facebook just a chance to catch up with this. What do you think? Anything in particular on this? Sinus tack. Yes, Teresa, you are fast, girl. You are a fast typer. Yes. Leanna, yes, sinus tack. So this one's just a tachycardia. I pulled up and cut just the V1 so you could see it a little bit and see a little bit closer. If I'm ever worried about anything, I do look at V1 because I can see whether those P waves are biphasic, and I should have a inverted T wave, an inverted T wave. So that would be the best thing that you're looking for there. Oh no, this patient, what do you think? He was on the toilet and collapsed. This is always my day in the CVICU, is patients that are sitting on the toilet and then this happens. Yes, a type of VTAC, which is torsades. Yes, it's a type of VTAC, is torsades. So, but you do use a different type of medication for that one. So Does anybody know what kind post Thanksgiving turkey? Yes, you've had that bad day in the ICU, haven't you? I know, right? I know that. Leanna, you need to join us in the 30-day. We just did a class this last week on vasoactive drugs. In fact, I forgot to erase my board. I still have my board up. So I did do this one as we did last night, because I just want to always right in the middle, make sure that you're remembering on those EKG, or excuse me, on those coronaries, what they're called. Tell me again what the coronaries are called. That one that goes down the middle, that great big red one that I have down here. Yes, KJ, Matt. Yes, KY, Rahim. Oh, y'all all have it with magnesium, with torsades. Yes. So right coronary artery, the left circumflex, and that left anterior descending, Yes. Perfect. Oh, I should give the answer, right? That would be better. Okay, left anterior descending, left circumflex, and right coronary artery. Don't forget about the right coronary artery. Nobody seems to care about the right side. I'm a big right side advocate because nobody pays attention to the right. Okay. Oh no, this is another fast one. Ooh. What is going on? Is this sinus tachycardia though? What do you think about this one? This patient was a male patient, 25-year-old male, came in and he had palpitations kind of off and on. What are you thinking? What are you thinking? Yeah, like an SVT, atrial tachycardia. Yes, some type of atrial tachycardia. Something's going on in that atrium, and it's some type of SVT. And if you look at that R wave in AVR, my thing is when I look at SVT, and I'm not quite sure, I know it's thin. I know the QRS, not thin, that's not the right word. Then the QRS is narrow. My first go-to is AVR. I love AVR. I go there first. If that R wave is negative, like it should be, then I'm thinking that electrical activity is still coming from up there in the top of the heart, someplace in that, not the sinus node, but in that atrial activity, in that atrial area of the heart. So I always think it's coming from that atrial, not the ventricle. That's one of my first things to look at. I look at the rest of the EKG, but I look at that first. Okay. Oh, you're right. SVT. Ah, awesome. Okay. Let's see. What do we have? Oh, this one actually was my my friend sent me this last week. 53-year-old female on dialysis complained about weakness. What do you think is going on with this one? Teresa and TK won the badges. Woohoo! Awesome. I see that Jen is typing in the chat on that one. That's an incredible first degree block. Yes, it is, Leanne. It is a first degree block. Yes, Teresa. Johnson, Marissa. Oh, y'all got it. Y'all are just too fast for me. Yes, that is a first degree. And I actually drew it out in case you couldn't see on here that it is long on that PR interval is way too long. And I like what Jen says. The clues are in the PR. The clues are in the PR. I was trying to think of a way to say that, Jennifer. The clues, when I think of clues, I go back to the kids when they were little and do Blues Clues. But that
would be a fun game. Maybe some other
I know,
time.
right? Yeah, we need a Blues Clues game. I would love that. So the zebras made another appearance tonight.
Yay!
What do you think about this? What are those zebras looking at? Oh no, what did we lose? Blues Clues. I know, KJ, right? Blues Clues. What do you think about this? The zebras are looking for something. What are they looking for? Ventricular standstill. And what is going on? What happened? There was definitely, yes, there was a third degree. Then where did the ventricles go? Exactly, right? So there was a third degree, and then you had complete block after that on the ventricles. Awesome. So third degree into a complete block. Leanna says they got tired. I know. The ventricles do get tired. Ventricles do get tired. So this one should be pretty good, pretty easy. The ventricles have left the chat. Matt says the ventricles have left the chat. I love that. I'm gonna remember that one. Thanks, Matt. I'm taking that one. What do you think about this? Ugly AFib. Yes, Teresa says ugly AFib. Is there a pretty AFib? Is there AFib? Can it be pretty? No, I don't know. I don't know. Is there such a thing as a pretty AFib? I don't know. Okay, the last one. The last one. Y'all know what it's going to be, right? Because we have to end with really yucky stuff. Your patient was talking to you, and then this. Oh no. And it's 15 minutes before the end of your shift. So the patient was talking to you 15 minutes before the end of the shift. And as Esprit says, VFib. Yes, Marissa, VFib. It was the end of your shift. The end of their shift too, right? VFib. And I put a little defibrillator up there. So we'd remember to defib with VFib, just so that you would know what you're supposed to be doing with that. Oops. Sorry. Let me go back. There. Okay. All righty. That is it.
All right. I'm going to share my screen with these folks now. Oh my God, look, Baby Yoda and the zebras.
I know, Baby Yoda and the zebras. Okay, stop share. There we go. Got it.
That was amazing. So I don't know if you guys want to do another game tomorrow night. What are your thoughts? Do you guys want another?
What are we doing tomorrow night, Jen?
We're going to do basic 12 leads.
Oh, okay.
And so, yeah, type in the chat if you want another game. We might be able to coax Michelle. I mean, we coaxed her tonight. It wasn't supposed to happen. So maybe if we give her a little extra coaxing, let us know if you want another game.
I love making the games up.
We are so lucky to have such an amazing game hostess. Thank you for that, Michelle. That was really fun. I think it rounds out the lecture so well when you do that. So I wanted to get you prepped for tomorrow night, because tomorrow night we're giving away the scholarship. So I want you guys to start getting excited, because we are going to start another 30-day EKG challenge, which is basically like this, but more EKGs, right? We're just scratching the surface here, and really not even that much. It feels like you guys are getting a lot of knowledge, but really it's just the basics and not even all the basics. So we started the basics in the 30-day, and one of you is going to win tomorrow night. So let me tell you what you're going to win. So you're going to win access for a month, the month of July, in the group with us, where you'll have access to all these live events. Okay. So if you'll be in for the study hall with David, which is kind of, it doesn't really kick off the study, it doesn't kick off the 30-day, really, it's going to kick off on the 11th. So we can get through the holiday and everything. If people want to take a break, it kicks off officially on the 11th. But if you get in like you would as the scholarship winner, you'll get to come to the 2 events. You'll get to come to the David study hall and the scenario practice, where I have lots more scenarios, just like the one I showed you tonight with the palpitations, lots more like that, where we can actually go over that. So that'll be a bonus session where we'll talk about, how do you work them up? What should you do? Things like that. That's a bonus session. Okay. Then we have Michelle, our wonderful Michelle. She's going to do 12 lead basics. This is, of course, recorded. It's all very visual. She has a special workbook for you. Then I'm going to do my workshop with you, which you'll get that big box that I showed you yesterday. You'll get that big box with all the presents in it. And we'll do the workshop together with the hands-on stuff. Okay. We'll do 17 real EKGs together. Then you're going to get practice 12 leads with Michelle on Monday, and then study hall with me, where we'll talk about some topic that you guys want. Then we'll do more arrhythmia practice with Gary, and you'll meet him Thursday. So you'll get to see kind of his style. We'll do more study hall with David, who he lets us send EKGs to him, and then he breaks them down for us on his classes. But also he sometimes has themes like bundle branch blocks, or how to really detect AFib, that's 2-to-1, how to do scarbosis criteria. So he has all sorts of cool topics that he does. And then on the 24th, we'll do EKG practice with me. And then we'll do a lecture at the very end, which is a heart failure preserved ejection fraction update on the guidelines as a little bonus snack. Okay. And we're also going to have some special classes on July 23rd, and you're going to get the recordings to those. So you are going to be a very lucky scholarship winner. access to all of those with joining us in our 30-day EKG challenge. Now, this is just the live part, right? Which is a lot of fun, but they're all recorded except for the Garys. So that's pretty cool. And you also get, like I said, a hands-on workshop with Michelle, a hands-on workshop with me, and those are recorded so you can rewatch them. Michelle goes really deep into the coronary anatomy and how it matches up to the EKG. I go deep into the contiguous leads, color coding, and doing cases that are really like something bad, but very subtle. So that's kind of my specialty, getting you so you're a safe provider. We don't start off with that. We start off with the baby steps, right? We do basic, 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 and then jump you up to later in the challenge to be a little bit more high risk stuff. So we also have, as a bonus, you can see all of these if you win your scholarship, or of course, if you join us, you can see access to all of our previous recordings in the 30-day, all our previous classes. We have CHF guidelines updates. We have farm classes, how to read stress tests, LVAD, lipid cases. We have that every month with our lipid queen, sleep apnea, terminology, STEMI deep dives, prescribing anticoagulants, like all sorts of juicy topics. It's actually been almost 3 years now, not just 2. So you can have access to all those recordings and just jump in and see what you want to watch, right? So as a scholarship winner, you get a month access. You will get one of these kits sent to you. I will send these little kits to you with the workbook, the painting, the crayons. It will be mailed out to you. And so we'll be announcing that winner tomorrow. But if you want to join us and you don't win tomorrow, just a little heads up, here is what you will get if you win, or if you are a paid member, you will get 6 months, not just 1 month. And so if you're a student and you don't need any CE, you can jump in for $149. You still get all the presents, right? If you're EMS, $149, you get 12 hours of CE. If you're an RN, $249 with 12 hours of CE, and NPPA is $299. And you still get all the presents, but you're going to get a couple extra bonus presents. When, as a paid member, you're going to get a binder as well that you can fill with all the notes and to keep you organized. And you're going to get some note cards. So I'll show you those tomorrow, but they're super fun. So don't worry, if you want to join us, you still can, even if you don't win. But we will be giving that away tomorrow night on the live. So if we can convince Michelle to do a game, I'll select our winner. Again, we're going to select the winner of the scholarship based on who's helpful. It's encouraging, because that's what we really truly love in this group. Okay. LPN, is there a different price? It would be, I don't think we have LPN CE, so you could just do the student rate, which would be $149. I think that would probably be the best bet. If you don't use RN CE, I would do it that way. Tori just posted the link for us, and yeah, so definitely be back tomorrow, same time, same place, same Zoom link, 5:30, basic 12 leads. And yeah, I'm super excited, Leanne, for you to be with us. Cardiology is, you're going to be a great NP. We know that for sure. If you have any questions, let us know. And I will see you guys tomorrow. Michelle will be here as well. Tori will be here as well. Same gang, same place. And remember, we have that bonus session on Thursday night that won't be recorded, unfortunately. That's the bonus arrhythmia with Gary. But still going to be so fun. So that one is 5:30 on Thursday, and you definitely want to be live for that one. All right, guys, if you have any questions, let us know. We'll be back tomorrow night. Michelle, thank you as always. You're amazing. And we'll see you guys tomorrow. Bye.